Now, March is very interesting because we have a lot of diseases that are connected to March, and one of them is colon cancer. And this is important for everyone to know because colon cancer is completely avoidable. And through screening, we can find this disease. Second leading cause of related death, about 143,000. Can you imagine 143,000 men and women can get colorectal cancer? 50,000 can die from this. And just with simple screening tools, we can actually prevent this. So I want you to know about this. What are some of the risk factors for colon cancer? Well, age is one of them. As you get older, you would have higher risk of this. We know a lot of fatty food, and certainly red meat is a huge risk factor. Diabetes and obesity seem to be also in the list, excessive alcohol, but also a lot of inflammatory bowel disease. We've talked about Crohn's disease and also ulcerative colitis. Those are all risk factors. And if you see any blood in your stool, don't ignore it. It could be hemorrhoids, but it could be a lot of other things. And I want you to see your doctor. So what do you do for screening, which should start at the age of 50, by the way, you all ask. And if we don't get to you on the radio, come on our Twitters and Facebook. We're putting a lot of these topics out there for you. Ask your questions, and I'm happy to answer them. Screening involves colonoscopy. And what that means is that you're going to take that prep, which is not always pleasant. You're going to go to the doctor's office. You're going to get IV sedation. They're going to put the tube all the way from the rectum and look at the entire bowel. But if you find some polyp, you can either burn it or you can remove it, and it actually can cure you from colon cancer. But I also want to talk to you about something called Cologuard. And Cologuard is something that's completely non-invasive. The company will send you a stool kit, and you will basically send a sample to the company. And instead of just looking at the blood, they're looking at the DNA cells. You know, your bowels and your colon will be shedding some cells that are suspicious for colon cancer. And that's what they look for. Interestingly enough, they put about 10,000 patients, colonoscopy patients, against Cologuard, and Cologuard was 92% predictive of whether you have cancer or not. And I like it because I think a lot of older men may not want to go through colonoscopy. They may also want to be avoiding any kind of complications from anesthesia. There's about 1 to 2% risk of perforation from colonoscopy, even though it's a very safe procedure in the hands of experienced doctors, but you can still have complications. And if you want to avoid it, look into Cologuard. It's about $600. Medicare just approved it, so they will pay for it. Blue Cross Blue Shield, believe it or not, just jumped on a bandwagon, and they would approve it. But otherwise, I think it's a good investment in yourself. And what's interesting is I found out that about a third of the population over the age of 50, they don't even go for screening. So if you're afraid of having this tube all the way up your colon, go for Cologuard. And it's something for you to look into. I think it's an easy test. It would basically find not only like malignant cells, but also pre-malignant cells. And if it's something positive, then we can look in with a colonoscopy. So this month is colonoscopy month, and colon cancer, it can be completely avoidable. If you have diarrhea, if you have constipation, if you have any blood in your stool as a result of hemorrhoids, obviously you want to avoid doing that test until it's all resolved.